My name is Carlos Warter. I was trained as a psychiatrist and a psychologist, but I like to call myself a spiritual activist, since I have realized over the 50 years of my career that the spiritual element has been neglected in our society. And if I look back at any moment in history, healing and spirituality were hand in hand. I want to speak today about a phenomenon that's taking place for the second time in my life, which is the new revolution in psychiatry with the use of psychedelics. I say the second time because around 48, 50 years ago, I was trained in the use of these substances in my native country, where at the university clinic, we would do experimentation with what has been named entheogenic or psychedelic medicines. We find ourselves now in phase 2. The world has rediscovered that for the treatment of depression, for instance, we don't subject ourselves to the SSRI or SNRI, Prozac and the like, which produced a tremendous advantage in the healing of thousands and thousands of people, since this pathology is very, very common. But we have jumped from the serotonin to the glutamate, two basic amino acids of our system that need to be regulated so that we don't experience the horrendous symptoms of depression or bipolarity. Ketamine seems to be the new kid on the block. Ketamine has been used for many, many years as a dissociative anesthetic. And since the late 70s and 80s by the Soviet Academy of Science as an antidepressant, since it binds in what's called the NMDA receptors, which alter the metabolism of glutamine and aspartate, two metabolites which seem to be very, very important in the treatment of depression. Who can get ketamine? Obviously, since the symptoms are the symptoms of depression, it has been established that in a treatment-resistant depression or an ongoing depression, which does not respond to the classical substances that cure it, antidepressants and the like, a dose of ketamine with the maintenance of the antidepressants produces extraordinary results in the healing of this pathology. What happens then? The maintenance of this healing needs to be done in a progressive period of time destined to zero, so that there is no dependence created with the substance, and at the same time that the person can experience a relief of the tragic symptoms that he or she has been living with. As I said before, ketamine was known as an anesthetic and was used both in veterinary medicine as well as in pediatrics as an inductor of dissociative states, which have the advantage of non-compromise of the respiratory system, one big advantage, since other anesthetics do produce a depression of the breathing process, symptom that we won't find with ketamine. Over the last 20 years, it was known as a street drug, known as vitamin K, used in parties and so on. But we don't want to dive into the illegal use of ketamine, but we want to be present with the understanding that this has been an approved substance by the DEA and the FDA in the treatment of resistant depression. So I invite you to find out more if you fall into this category and come to our Ketamine Quest, which is a 3-day program destined to produce A, the healing of a symptomatology of depression, and B, a new context for experiencing living. Thank you.